The advice and opinions expressed by Dr. Grant-Piche and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grant-Piche is Dr. Doreen is an expert in autism. Doreen Grant-Piche.
Dr. Grant-Piche.
Dr. Doreen Grant-Piche.
Dr. Doreen Grant-Piche is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
How has Dr. Grant-Piche's view of autism changed over the years and why? So maybe you can put them together.
Yeah, that's great. So I can kind of maybe bring it all together.
Yeah.
I guess when I first started in this field, I was very young, and the field that was just coming about, which was a good thing because before we started looking at autism as in terms of behaviors, in terms of symptoms, there was this kind of Bettelheim era, which was sort of a ridiculous era of belief that autism had something to do with cold parenting. And, so we were just coming off of that because we're talking the 70s is when I got involved with autism, right? And so it was very refreshing, really, to come into a field, which obviously in those days it was just psychology, and that would say, no, it has nothing to do with that. And by the way, these individuals are very intelligent, and they just learn differently because this whole field of defined behavior analysis, the original name was behavior modification, which is based on learning theory, learning psychology, the subsection of psychology, which is learning. And so the whole concept was now individuals who are diagnosed can learn. They just learn in a different way than others. And we have to figure out how to teach them that works for them. So that was, I think, the first kind of decade of my life in autism was like, what are the things we got to do to make learning easier? And, basic things, like how do you simplify instructions so they're not too confusing or too long? And being someone who speaks a few languages, all of this stuff resonated with me because it was kind of like, oh yeah, when I go to France and people are speaking very, very quickly in French, it's very difficult for me because there's a lot of just words that are not necessary. And if someone was to speak in short segments or slower, it would be very helpful to me to understanding. So that was it was just honing in on how do we make our instructions better? How do we focus on breaking down skills that need to be taught into their most basic parts and how, the basis of what is now ABA. So that was the first many years. And as I got involved with people who had autism, I learned that there's a very strong sensory aspect to this. And of course, that's a very, now coming full circle because back in the day when I was learning this stuff, so kind of like now we're 80s, nobody was really looking at the concepts of sensory issues or sensory dysregulation or the need for certain sensory input or getting overwhelmed by other sensory. Nobody was looking at any of that, right? It was just, if it wasn't the typical, it wasn't okay. And so then I learned a lot about how we, of course, we learn everything through our senses, right? Through our vision and hearing. And if those are functioning differently, I really even like to use the word dysregulated. If they're functioning differently, we're going to learn differently. And Shannon, don't let me forget, I want to come back to that because I also just had a amazing lecturer, Dr. Ami Clint at ADAI, and it kind of full circles back to the sensory input and learning. Let's talk about that. So, but anyway, so then I learned a lot about that. And of course, as you know, very early on, and this is all just, my kids, through the kids that I treated, right? Like I had a little boy who just would not pick up instructions, and we found out he is actually very close to being completely deaf. So we were like, oh my gosh, we got to really focus on the sensory. But I had another little boy who could not focus on stimuli that were presented to him because he didn't have the ability to focus both eyes, called binocularity, on an object. If it was anywhere, I think it was from like the tip of his nose to something like 4 feet out. He couldn't focus. So, I mean, imagine what you see and people trying to teach you stuff and you can't actually see it properly. So a lot of just seeing things from that angle. And then, of course, was the incredible, one of the big lessons for me was the biological stuff that goes unnoticed. So the medical issues. And of course, thanks to my dear late friend, Dr. Bernie Revland, who really pulled me into, look at the medical aspects of what's going on with each of these children that you treat, pulled me into a different world through what was then the Dan movement. And I kind of got to know a lot of the doctors and learned a little bit more about their world and what they were seeing with their patients. They were all focused with autism. I was seeing all these kind of like behavioral symptoms and external things, also psychological things, but they were seeing, incredible amounts of inflammation, gut inflammation, kids who were just very, very sick, had very little sleep, had extreme gastrointestinal issues that were being really going unnoticed because everyone was just thinking of autism as a pure mental disorder on no biological basis. Mm-hmm. So then I started to really learn more about that. And through that world of, oh my gosh, like so many of our kids have medical issues. So that was a fascinating period for me because we were working with doctors and we would treat one aspect of a biological, like let's say, a child who would have diarrhea 5 times a day. And so we would treat that and we would see that the child is now becoming much more comfortable, much more at ease, much more able to pay attention, learn, listen, etc. Or, a story I often remember is that I had a little girl who had, you shouldn't have this little child, but she had fungus on her nails. And so we treated the fungus with medication for her nails. And her attention changed, and her ability to learn changed. And I was like, oh my gosh, this is candida. This is affecting her brain. And we really started learning about all the medical issues that cross the blood-brain barrier and actually affect learning and attention and all of that, which, by the way, is kind of what's happening to a lot of us right now, too. But so then that whole experience then took me into what else is in our environment that is hurting not just these children, but in general, everyone, right? So what are the causes of toxicity in our world? And that was a really big revelation, I think, for me, and I saw it affecting so many of my kids. And I don't know if you remember the whole movement. I think one of the big things people don't realize that autism brought to the world were these diets and how you can eliminate or you should eliminate things that you are not able to process or not able to digest. Casein-free, gluten-free, a lot of that kind of stuff. And you remember, Shanna, maybe I want to say 20 years ago, maybe 30, 20, 25 years ago, you couldn't go to a restaurant for the say you have something gluten-free. That was the joke. You couldn't, in a lot of countries, you couldn't buy anything gluten-free. And it was because of autism. I will always say this. It was because of parents of kids with autism who pushed and pushed and pushed for this. That we now do have products that are gluten-free and casein-free and so on. And that takes you back to why can they not digest gluten and casein and so on. And that takes you back to what is wrong with our wheat products and our cows and all this other stuff, which is a whole other lecture on toxicity in our environment. But basically, those were extremely important lessons I think that I learned in terms of how to look at autism and how to treat it. There's so many other things though, Shannon. I mean, I think I learned about strength from all the moms and the parents, like that, how they would go from just being completely devastated on a day of diagnosis to being warriors and just moving the needle and making things happen for not just their own child, but for thousands of other kids to come in different ways, which is what's always fascinating to me. And I learned that. And you know, of course, during this whole 50 years almost, education changed, the field has changed, and now people go and get their master's or doctoral degree in autism types of specialties and ABA. I mean, when I started in this field, the prevalence was somewhere between 1 in 10,000 to 1 in 15,000. And now, of course, it just became 1 in 31 kids, which is incredible. So one has to ask oneself, what is going on? We know there are genetic components to this, but we also know that they're triggered by environmental components, and one has to really look at that. So those are, I guess, some of the main things that I learned. I will say, Shannon, when I came, you know, as you know, I kind of left a little bit. Not that I ever left, but I exited the world of running a big company in autism service provision. I exited more as an ABA world, I'd say, because you and I continued forever. But when I came back, which was basically end of 2023, I saw that things have already changed. So the dark side, I guess, is that I've learned that when money becomes an issue, it does affect the quality of treatment. It does affect treatment as a whole. And I'm sad to see that because I think that overall we've lost perspective a little bit. And a lot of things have changed over the last few years. I'm happy to talk about those as well. But they are not things that I would have liked. I'm trying to reverse some of those things in terms of how we look at autism again.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.